hypertension, heart failure, and muscle loss, why proactive management is needed. Diuretics, commonly known as water pills, are essential medications in cardiovascular medicine, the field of heart and blood vessel health, indispensable for managing conditions like high blood pressure, hypertension, and heart failure. However, their relationship with your muscle health is nuanced, meaning complex with subtle distinctions, and critical. A growing body of understanding reveals how different types of diuretics can impact your muscle mass and function, highlighting the absolute necessity of properly managed diuretic use to preserve your muscles and prevent a cascade of debilitating complications. The essential roles of diuretic classes. Different classes of diuretics serve distinct, yet crucial, roles in your heart health. Thiazide-type diuretics, e.g., hydrochlorothiazide, microzide, chlorthalidone, hygroton, these are commonly prescribed as first-line agents for high blood pressure. By acting on your kidneys to increase sodium and water excretion, they effectively lower blood pressure. Crucially, large randomized controlled trials, RCTs, which are large, carefully designed studies where patients are randomly assigned to different treatment groups to fairly compare how well medications work, have shown that thiazide-type diuretics are highly effective, often superior, in preventing the development of heart failure in people with hypertension. Loop diuretics, e.g., furosemide, Lasix, Furosix, torsemide, Demodex, Psoans, bumetanide, Bumex, ethacrynic acid, Etacrin, these are the most potent diuretics, primarily used in heart failure patients to manage significant fluid overload and congestion, too much fluid buildup in the body, leading to symptoms like swelling and breathlessness. Their use is typically reserved for cases where active symptoms of fluid retention are present and deemed necessary for relief. They rapidly alleviate symptoms like breathlessness and swelling, thereby preventing hospitalizations and improving your comfort. Potassium-sparing diuretics, e.g., spironolactone, aldactone, eplerenone, Inspira, these are often used as add-on therapy in heart failure due to their unique neurohormonal blocking effects. This means they help counteract some of the harmful chemical signals, hormones, in your body that can worsen heart failure and contribute to muscle loss. They can also help balance potassium levels, which other diuretics might lower. Beyond this, in heart failure, medications like spironolactone and eplerenone are known to directly improve long-term outcomes and even benefit how your muscles use energy and grow by blocking a hormone called aldosterone. This makes them a very important part of a heart failure treatment plan. The silent epidemic, muscle loss and its complex drivers. Muscle loss, sarcopenia, is a pervasive, widespread issue in chronic disease, but it's particularly pronounced in cardiovascular conditions. The severe form, cardiac cachexia, pronounced cachexia, is a hallmark of advanced heart failure, representing significant, whole-body muscle and weight loss. Heart failure, the primary driver of severe muscle loss, sarcopenia and cardiac cachexia are alarmingly common in heart failure patients. This is driven by a complex interplay of chronic systemic inflammation, a widespread, low-level irritation in your body that can damage tissues over time, neurohormonal activation, those harmful chemical signals, reduced physical activity due to fatigue, malnutrition, and metabolic dysfunction, problems with how your body processes food and uses energy, which can make it harder for muscles to function properly. This profound muscle loss significantly increases your risk of worsening symptoms, hospitalizations, falls, and mortality. Thiazide-type diuretics in hypertension, indirect protection against severe muscle loss. By effectively preventing the development of heart failure, thiazide-type diuretics indirectly reduce your risk of the severe and systemic muscle loss that is characteristic of advanced heart failure. This is their primary, muscle protective, role in hypertension. However, if not managed, thiazide-type diuretics can cause electrolyte imbalances, a disruption in the balance of essential minerals like potassium, sodium, and magnesium in your blood, such as hypokalemia, low potassium, or hypomagnesemia, low magnesium, that can lead to muscle weakness and cramps. These are typically localized symptoms, affecting specific muscles, and are distinct from the severe, whole-body muscle wasting seen in cardiac cachexia. Loop diuretics in established heart failure, a growing concern for direct muscle wasting. While absolutely essential for managing dangerous fluid buildup, congestion, in heart failure, emerging research is raising important questions about a more direct link between loop diuretic use and skeletal muscle wasting in heart failure patients. It's a newer area of study, but some research, like the Nakano et al. 2020 study mentioned, has found an independent association between taking loop diuretics and having smaller muscle circumference. This suggests that beyond simply causing electrolyte imbalances, which can lead to weakness, these potent, water pills might have a direct effect on muscle cells themselves, potentially contributing to the overall muscle loss that is already common in heart failure. Scientists are actively investigating how this happens, with theories suggesting they might affect how muscle cells produce energy, impacting the mitochondrial function, which are like the tiny powerhouses inside your cells, or disrupt the processes by which muscles build and repair themselves, protein synthesis. Heart failure patients often require high doses of loop diuretics for extended periods, making this potential direct effect a significant and active area of investigation for researchers and clinicians. It's an important consideration as your doctor works to find the best treatment plan for you, balancing fluid management with muscle preservation. Potassium-sparing diuretics, these are generally not associated with muscle wasting and may even offer some protective benefits by preserving potassium levels and influencing neurohormonal pathways. In fact, in heart failure, these medications have been shown to help patients live longer and improve how their muscles function. The imperative of proactive management for your diuretic use. Given this complex relationship between different diuretics and muscle health, properly managed diuretic use is non-negotiable. This applies to all diuretic types, but particularly to high-dose loop diuretics in heart failure. Your healthcare team works to make sure you get the most benefit with the fewest side effects. Proactive management involves meticulous monitoring, regular blood tests for electrolytes, potassium, sodium, magnesium, kidney function, and glucose levels are crucial. For initial assessment or dose changes, tests are typically done within 1 to 2 weeks. Once stable, monitoring frequency may decrease to every 3 to 6 months, or more often if your clinical status changes. Targeted dose and type, using the lowest effective dose to achieve your clinical goals and manage congestion. For heart failure, this means carefully adjusting loop diuretics to manage symptoms and achieve optimal fluid balance, using them only when deemed necessary to alleviate active congestion. Knowing the signs, how to tell if your dose is right. Symptoms that might suggest underdiuresis, not enough fluid removal. Increasing shortness of breath, especially when lying flat. Swelling, edema, in your legs, ankles, or abdomen that gets worse. Unexplained weight gain, more than 2 to 3 pounds in 24 to 48 hours, or consistently trending up. Feeling more tired or generally heavy due to fluid buildup. Symptoms that might suggest overdiuresis, too much fluid removal, leading to dehydration or electrolyte problems. Feeling lightheaded or dizzy, especially when standing up quickly. Extreme thirst or dry mouth. Unexplained rapid weight loss, more than 2 to 3 pounds in 24 to 48 hours, or consistently trending down, unless this is your doctor's target goal for fluid removal. Muscle cramps, weakness, or unusual fatigue, beyond your usual heart failure fatigue. Feeling confused or disoriented. Your doctor will use these symptoms, along with your daily weights and blood tests, to fine-tune your diuretic dose. The goal is to reach an optimal balance where you feel good, your congestion is managed, and you're not experiencing side effects from too much or too little medication. Electrolyte correction. Aggressive and proactive potassium and magnesium supplementation when imbalances are detected in blood tests is vital to prevent muscle weakness and cramps. Patient education, empowering you to understand your medication, monitor symptoms, like sudden weight changes, dizziness, muscle cramps, and adhere to dietary advice, sodium restriction, appropriate potassium intake. You may be advised to weigh yourself daily at home. Holistic approach to muscle health. Integrating diuretics into a broader management strategy is key, and this includes essential non-pharmacologic interventions that directly combat muscle loss and enhance your overall well-being. Optimized nutrition. This is critical, especially ensuring adequate protein intake. Protein is the building block for muscles. Discuss with your doctor or a registered dietitian how much protein you need and the best sources, as nutritional needs can vary, particularly with conditions like heart failure. Tailored exercise programs, regular physical activity, especially resistance, strength, training, is incredibly important for building and maintaining muscle mass. Even gentle exercises, when done consistently, can make a difference. Your doctor might recommend a cardiac rehabilitation program, which provides supervised exercise, education, and support tailored to your heart condition. Physical activity also helps manage other comorbidities, other health conditions you might have, and improve overall energy levels. The consequences of neglect, why it matters to you. Failure to properly manage diuretic use, particularly in real-world settings where monitoring may be less rigorous than in clinical trials, carries significant risks for your health and quality of life. Unmanaged electrolyte imbalances can lead to chronic muscle weakness, cramps, and fatigue, severely impacting your mobility and increasing your risk of falls. Imagine struggling with simple daily tasks like walking, dressing, or carrying groceries. Exacerbation of sarcopenia/cachexia. In heart failure patients, unmanaged diuretic effects, including potential direct muscle wasting from loop diuretics, could worsen the already severe muscle loss inherent to their disease, accelerating your physical decline. Increased morbidity. While not directly causing conditions like hernias or rectal prolapse, severe muscle weakness and overall frailty, often exacerbated by unmanaged muscle loss, can contribute to an increased risk of these structural issues, requiring further medical or surgical intervention. This further burdens already compromised patients. Reduced quality of life. The cumulative impact of muscle loss and related complications profoundly diminishes your independence and enjoyment of life. It can impact your ability to participate in hobbies, socialize, or play with grandchildren. What you should watch out for. If you are taking diuretics, pay attention to these signs and contact your doctor if you experience new or worsening muscle cramps, weakness, or spasms. Unusual or increasing fatigue that isn't relieved by rest. Feeling lightheaded or dizzy, especially when standing up. Sudden or rapid weight changes, more than 2 to 3 pounds in 24 to 48 hours, that are not your fluid goal. Confusion or disorientation. Conclusion, a call for vigilance and empowerment. Diuretics are vital tools for preventing and managing cardiovascular disease. Thiazide-type diuretics play a crucial role in high blood pressure by preventing heart failure, thereby indirectly reducing the risk of severe muscle loss. Meanwhile, loop diuretics, while essential for managing congestion in established heart failure and only used when necessary, have an emerging potential to directly contribute to muscle wasting in this vulnerable population. This nuanced understanding underscores that while diuretics are therapeutic necessities, they must be wielded with precision and careful monitoring. The goal is not just to control blood pressure or remove fluid, but to do so in a manner that preserves vital muscle mass, prevents debilitating complications, and ultimately secures a better quality of life for you. The real-world challenges of inconsistent monitoring only underscore the critical importance of adhering to best practices in diuretic management across all patient populations. You are an important part of your healthcare team. Don't hesitate to ask your doctor questions about your medications, blood test results, and what you can do to protect your muscles and overall health. Specifically, you might ask your doctor about the potential impact of your loop diuretic on muscle health and what strategies can be put in place to monitor and minimize any muscle loss. By working together with your healthcare providers, you can ensure your water pills are truly helping you live your best life.